you want to just have a seat?
Thank you.
So we're just going to go through your health history. Just have a few questions to ask you.
Okay.
I noticed that you had hip replacement surgery 3 months ago.
Yes.
How are you doing with that?
Pretty good. It's a little bit stiff, tight, and a little bit pain.
Okay, I did notice that you were compensating in your gait a little bit. And I also see that you were a former runner. Is that something that you would like to get back to?
Yes, definitely.
Okay.
Actually, my surgeon gave me a surgical protocol for you.
Perfect. Okay, so do you know what type of hip replacement it was?
Yeah, it was a posterior lateral hip replacement.
Okay, and did you have any previous injuries before the surgery?
No.
No? Okay, any other joints affected at all?
Nope.
No? Sorry, by osteoarthritis?
Oh, yeah, my knee.
Okay, your knee, okay. Any other conditions that I should be aware of at all?
Nope.
No. And are you still wearing compression socks?
No, not anymore.
No? Okay. Any complications with the surgery?
No complications.
No? And I did notice in your health history that you were taking aspirin. What is that for exactly?
It's just to carry over from the surgery to be on a blood thinner.
Perfect. And are you taking any dietary supplements at all?
I take glucosamine for my joints.
For your joints? Okay, perfect. And any infections post-surgery at all?
No infections.
Okay, perfect. Okay, so we're just going to start by asking you a few pain questions. Do you mind just showing me where the pain is? Just the location?
Right here.
Okay. And that was from the hip surgery, or is that from something else?
From the hip surgery.
And that was 3 months ago?
Yes.
Does your pain radiate or go anywhere else?
It just kind of, I can feel it a little bit along here in the back of my leg.
Okay. And what is the frequency of your pain?
Ongoing.
Ongoing. And on a scale of 1 to 10, 1 being to little to no pain and then 10 being the worst pain you've ever felt, where would you say that this pain is?
A 4 out of 10.
4. And if you had to describe the pain, how would you describe it?
Pretty achy, stiff, and tight.
Okay. And is there anything that aggravates the pain?
Whenever I'm bending forward to take my sock off, and going upstairs.
Okay. And is there anything that relieves the pain?
I started doing some stretches from what my surgeon gave me, and that helped a lot.
Okay.
And resting helps.
All right. And are you taking any other medications?
I do take Advil when the pain's too much.
And did you take Advil today?
No, I didn't.
Okay. So the next thing we're going to do is we're just going to do a postural assessment. I'm going to go through some range of motion, and then I'm going to do some special orthopedic tests. I can't modify these tests at all, and it may recreate some of the pain you are feeling. But if at any time you need to stop, just let me know. Do I have your consent?
Yep.
Okay, perfect. So we're just going to take your blood pressure first, and then we'll go through the tests. So we're just going to start with a postural assessment. Is it alright if I place my hands on you? Alright. So I do notice that your right kneecap is a little higher. And the muscle bulk on your rest in your quads is also a little bit bigger. And your right side, your right hip is higher as well. Just walk towards me and just come grab this pen, and then just walk back and just place the pen on the end of the table. Just walk towards me and just come grab this pen, and then just walk back and just place the pen on the end of the table. start with a little bit of range of motion. I'm going to start by ruling out just your low back and your knee. So I'm just going to start by getting you to just kind of roll your back and just make sure that you don't hinge at your hips. And then you can just kind of follow that down and just let me know if you feel any pain at all anywhere. So if you could do that. Okay. Any pain at all?
Just a little bit of tightness.
And that is as far as you can go?
Yeah.
Okay. And then what I'm going to get you to do is I'm just going to get you to go down to the side. So again, just kind of follow your hand down and then as far as you can go, and let me know if you feel any pain or anything.
Okay.
Any pain?
Nope.
No? Okay, perfect. So then, now we're just going to do your knees. So if you could just sit down on the chair. And then I'm just going to get you to just kind of kick your leg out. Any pain at all?
Nope.
Perfect. Is that it? So you're continuing with range of motion. In all movements, normally we would just do active and then passive and resisted. But just to limit your movement, potentially aggravating your hip, we're just going to do active, passive, and resisted, and extension, internal, external rotation. So after doing the unaffected side, everything was in normal limits. So I'm just going to get you to bring your heel to the ceiling.
Okay.
All right, Bill, if you could just try that again for me and just try and keep your torso on the table.
Okay.
Perfect. And then I'm just going to get you to bend your knee and then just bring your foot across your body. Any pain or anything like that?
Feels tight.
Tight? Okay. And then I'm just going to get you to bring it towards me. Any pain or anything?
Nope.
No? Okay. And then I'll just get you to bring it back down. All right. And then I'm just going to do it passively for you, all right?
Okay.
So just let me know if at any time you feel any pain or anything.
Okay.
How you doing?
Good.
Good? All right. How you doing?
It feels tight there.
Tight? And how are you doing?
Good.
Good? Okay, and then lastly we're just going to do resisted. So what I'm going to get you to do is I'm just going to get you to bring your leg just a little bit off the table. And then I'm just going to get you to hold. Just don't let me move you. And then just let me know how you're doing. Whenever you're ready, I'm going to build for 5 and hold for 5. 3, 4, 5. 2, 3, 4, 5. And I'm going to give you a 4 for that. And then now we're just going to do internal and external rotation. So then whenever you're ready, I'll just get you to push into my hand. And I would also give you a 4 for that. And then for this one, I'm just going to get you to push into my hand on this side. And then I would give you a 4 for that one as well. So we're just going to continue with range of motion. I'm going to get you to do abduction, adduction, and we're going to do flexion last just because you did have pain taking your sock off. So I'm going to get you to swing your leg out to the ceiling whenever you're ready. Any pain?
Yes.
And where's the pain?
Right here.
Okay, perfect. And then I'm just going to get you to swing your leg in. And any pain?
Just tightness.
And do you mind just pointing to where the tightness is? Same area? Okay, and then if you just bring it back, and then I'm just going to get you to bring your leg up. And any pain?
Just a little bit in here.
Same area? Okay, and then I'll just get you to bring it down. So now we're just going to do them all passively, and just let me know if you feel any pain at all. How you doing?
Good.
Good? Any pain?
No.
No? Okay. How you doing?
Good.
Good? Any pain? And then lastly, we're just going to do resisted. So I'm just going to kind of bring you into mid-range, and then you're just going to resist against my hand. Just don't let me move you.
Okay.
So whenever you're ready. Okay. So I would give you a 3 for that. And then I'm going to I'm going to bring you into a deduction, and again, just resist my movement. And alright, so I'd give you a 4 for that. And then lastly, just bring deflection, and then I would also give you a 4 for that as well. So I'm just going to give you this lower extremity functional scale. It's a grade reassessment tool, so after our 6 weeks of treatments, we can look back on it and get you to fill it out again, and I can see the progress that we've made. So once you're done filling that out, we're just going to go through a little bit of functional movements, just to, see where your pain is and see if we can recreate it at all. We're just going to continue with the orthopedic tests. After doing your unaffected side, we're going to do your affected side. So we're just going to start with Trendelenburg's. So if you want to just grab my hands, and then I'm going to get you to bring your left leg off the ground. Alright, and then you can just put your leg back on the ground. So you'd be positive. You do have a weakness in your right gluteus medius. Alright, so after doing the unaffected side, we're just going to continue doing Thomas tests on the affected side. So what I'm going to do is I'm just going to bring your knee up, and then I'm going to get you to hug it and just bring it towards your chest. Alright, and you can just bring your leg down. So you would be positive. You do have tight hip flexors on the right because your knee did come off the table. So we're going to continue with modified Thomas test. After doing your unaffected side, seeing that it was positive. This is just testing for specifically a tight rectus femoris, but it just pretty much means that you do have tight quads. So what I'm going to get you to do is I'm just going to get you to slowly bring your knee to your chest. Alright, and then on this side you would be positive as well for tight quads. We're just going to be working on an impairment massage, just focusing on your right hip. Some contraindications would just be some mobilization in your knee and your hip. Some benefits of this massage would just be to maintain your range of motion, decrease some of the pain you're having, decrease those fascial adhesions, and decrease the tone in your quads. Just some risks or complications, just you may feel a little bit sore or a little tender in those areas that we're working on today. Some consequences of not receiving this treatment today would just, I wouldn't be able to aid you in your post-operative progress, and I will not be able to help you meet your functional goals. You are in control of this massage at all times. If at any time you need to modify anything or change anything, just let me know. I will be checking in with you periodically, so if you have any questions, you can just let me know. If you find that, I know you are seeing a physiotherapist and you do have your surgeon, but if you find that we aren't reaching your goals, then we can just see if we can add someone into your circle of care that will help reach those for you. Do you have any questions?
Nope.
Do I have your consent to perform this treatment?
Yes.
Okay, Bill, do you feel secure in that drape?
Yeah.
Okay. So we started with your unaffected side, and while we treated your unaffected side, we had hydro to warm the tissues, and now I'm just going to keep this hydro on your left leg. Just let me know if it's too hot. So we're going to start with some static contact to relax the client. And some fine vibrations for analgesic effect. Okay. Just do a fascial assessment here, Bill. So this is some skin rolling. I'm just trying to decrease the fascial adhesions throughout your quadricep region. You doing okay, Bill?
Mm-hmm.
Just going to hold this for about 30 seconds. Continuing on with fascial work. Okay. How's my pressure?
Good.
So just doing some ringing here. Decrease the tone throughout the quads. Strip up the quads. Some tenderness there, Bill?
Yes.
Okay. Okay, Bill, what I'm going to have you do is I'm going to have you grab your sheet here and I want to keep yourself nice and secure. I'm going to be lifting your leg and doing some passive movement. So, are you okay there?
Mm-hmm.
How's that feel?
Good.
Okay. Just do that again. Just relax your leg, Bill. So now I'm going to bring your leg out a little. You feel secure? You're okay?
Mm-hmm.
Okay. Okay. So now, Bill, we're going to drape your leg and we're going to have you move on to your side, okay? Now we have Bill's sideline. We're going to concentrate on some fascial adhesions around the incision site, and we're going to stimulate glute med, glute max, and then we're going to work on vastus lateralis and TFL. So I just put some lotion on, and I don't know why I did that. Sorry about that, Bill. So I'm just going to begin here. Again with some static contact. And some light stroking for a relaxing and analgesic effect. Okay. Come up here near the incision site. So again, Bill, you let me know about my pressure here.
Okay.
Just going to do some compressions here. Just going to go around the site of the incision. Some myofascial release. I'm going to hold this. Till I feel a little creep. I'm going to do a little bit of stimulating work here. Bill, I'm going to do some stripping of your leg again. So again, let me know about pressure.
Okay. It's tender there.
You feel a little tenderness, yeah. Okay, I eased off a little.
Mm-hmm.
Okay. Just going to go a little bit more specifically here. Bit tender there.
Yes.
Okay, Bill. We're going to drape your leg.
Alright, so after your treatment today, I am going to prescribe you a little bit of home care. These are just things that you can do at home just to help reach our goals. So first I'm just going to get you to do a little bit of active range of motion. 5 times in the morning and 5 times at night. We will go through the movements right now just so you kind of have them in mind, and then I will give you something just so you can kind of follow up on. So I'm going to get you to go forward, and then obviously this entire time just maintain, work through your comfort level and your pain tolerance. If at any time it's too much, just stop or don't go as far, and then just backwards. And then I'm going to get you to come in the front, and then to the side, and then just rotate, and then outside. Perfect. Okay, and then another thing that I'd like for you to do is that if you have a day where you're doing a lot, you're standing, going upstairs and stuff like that, just to incorporate some hydrotherapy, so just some heat packs, specifically on your right hip, and then also on your quads. And then lastly, again with a very busy day, just incorporate some diaphragmatic breathing, just some deep belly breathing. So just kind of relax, close your eyes, in through your nose, out through your mouth, and just make sure that you're really, filling your belly up with air, and then just slowly letting it go. Questions?
How long do I keep the heat on for?
Maximum of 15 minutes a day.